We see these trends continue. The potential for a stay-at-home order for those regions in purple.
The governor warning another lockdown is looming. COVID cases are surging across the state and here in San Diego. Good evening. I'm Steve Atkinson.
And I'm Kimberly Hunt. Hospitals across the region are preparing for even more COVID-19 related patients in the coming weeks. ABC 10 News reporter Mimi Alcala heard from Palomar Health's chief medical officer about the plans to help other hospitals if they become overwhelmed.
Palomar Health has had the room to take on more COVID-19 patients from other hospitals for several months now. It hasn't needed to, but in the next few weeks, that may change.
We've seen a significant increase, 89% increase over the 14-day period.
COVID-19 related hospitalizations continue to surge across California. Without any intervention, Governor Gavin Newsom says current projections show hospitalizations could increase 2 to 3 times the current amount in just 1 month. San Diego County is also seeing numbers rise.
We're seeing about 3 times the number that we saw just a couple months ago. 25% of the positive patients are ending up in the ICU. That's less than we saw during the first spike.
Dr. Omar Khawaja is the chief medical officer for Palomar Health. He says he expects more hospitalizations in the coming weeks as COVID-19 cases related to Thanksgiving gatherings start to show up. Inside of Palomar Medical Center in Escondido, a federal medical station is set up with 202 beds that haven't been used yet. Khawaja says they're ready to take on COVID-19 patients from other hospitals across the county that become overwhelmed. But this setup is not meant for ICU patients.
It could be beds that we would be able to offload some of the less sick patients from other systems into there so that they could handle the sicker patients. We don't have a solid plan in place for it yet.
He says the details are actively being discussed with other medical officers.
Are we worried? Absolutely. Is the spike coming very quickly? Yes. But we do have some capacity and redundancy available now, and we are planning to have even more.
Creating more capacity could include scaling back on the number of elective surgeries scheduled. But this time, Khawaja says it'll look much different than what we saw months ago.
What we've done is essentially looked at surgeries and classified them in terms of how long could this be put off to be safe. We all saw that just shutting everything down led to some really just poor patient care, and we don't want to do that again.
Mimi Alcala, ABC 10 News.
Here are the latest numbers. The county reported 959 new cases today. That brings our total to over 82,000. There were no new reported deaths, typical for a Monday, so that number remains at 997.